Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me in the studio today from a Georgia cancer specialist is Dr. Jones. Welcome to the show, my friend.
Thank you.
We're talking all things cancer, okay? Now, often I think to myself, I wonder if all patients need chemotherapy. Can you maybe, enlighten our audience that may have the same views or thoughts?
Well, every patient that's diagnosed with cancer has to be evaluated by a medical oncologist.
Right.
Those patients with certain forms of cancer in the earliest stage may not need chemotherapy. However, it's a likelihood that they might be advised to reduce the risk of the cancer ever coming back and improving their survival. Anyone with advanced cancer certainly needs medical management.
Okay. The difference between chemotherapy and radiotherapy, is it doing the same thing? Because you hear people say, oh no, I have chemotherapy, I don't have radiotherapy.
So very different. So radiation therapy is a localized treatment. So
Right.
they're treating only one area of the body
Got
for a
you.
limited amount of time because the body can only tolerate so much radiation.
Right.
Chemotherapy is a strong medicine that's going through the body, hitting everywhere. So chemotherapy can be a targeted therapy. It can include immunotherapy. It can include hormonal therapies, several different strong medicines.
Many years having salons in Australia, and I saw many women and men go through chemotherapy and cancer struggles, many. And I also lost a lot of clients as well. Something that was being talked about a little bit was scalp cooling. Now, that's becoming more and more use throughout these last few years. Talk to us a little bit about that. What is it?
Well, one of the devastating side effects of chemotherapy is hair loss.
Yeah.
And it can be so devastating that patients refuse their treatment that could benefit them.
Really?
So for years, we've tried to cool the scalp, cause some vasoconstriction so the chemotherapy wouldn't get to the hair and maybe preserve it. Attempts early with cold caps and dry ice were not very successful. But modern technology, there is now a machine that is utilized. The patients get a specialized cap fit to their head, and it cools their head before, during, and then after chemotherapy to preserve the hair.
Oh, well, this is interesting. So whilst you're having chemotherapy, you are using this cooling therapy.
Exactly.
What's the correct terminology? Cooling therapy or scalp cooling?
So scalp cooling is the
Okay.
term we use.
So how long is that process? So you'd be having chemotherapy for how many hours?
Well, each regimen has a different length of
Right.
time. So typically the scalp cooling begins about 30 minutes before the drugs are infused for
Right.
chemotherapy, which is the time you're usually getting your nausea medicines
Right.
and things to prevent other side effects. Then you stay cool throughout the chemotherapy, and then the time afterwards depends on how long the chemotherapy and which drugs. So it does add a few hours,
Okay.
but it's all done within the day's experience
Got you.
in the chemo room.
FDA approved?
It is FDA approved now with these certain devices.
So does that mean that it would come under your insurance, or is it a treatment that is like an add-on?
So some insurance companies are covering it. Some insurance companies will only cover a very small portion, just like some cover wigs for
Okay.
other patients. And there are many foundations that help patients.
So it's something that we need to investigate
Exactly.
if we're unlucky enough to go down that path of
Every
needing to
patient.
have chemotherapy. How do they find out more information specifically about scalp cooling? Because I think that sounds amazing.
Well, you would first talk to your oncologist
Yes.
if you're eligible for it.
Yeah.
And then it's a process where it's pre-sorted just like any other medication.
It's perfect.
It is.
Again, thank you for coming
Thank
in,
you.
giving us great information. As always, there it all is up on the screen, everyone. Georgia cancer specialist, Dr. Jones. Give them a call and find out if maybe you might be the perfect candidate for scalp cooling. Back after this short break.